orders. So for reducing courses as an inpatient, we can link these orders to make it easier to understand and flow from one strength to another. So if you click on linked order at the bottom of the medicine you're entering, and then you'll get 3 types of linked orders. Okay, so the first one is followed by, and we'll use this if there's medicines that need to have one dose for a period of time, and this is followed by another. For example, if the patient was being commenced on apixaban for DVT, then you do the 10 milligram twice a day for 7 days as per the loading dose, and then you follow that by the apixaban 5 milligram twice a day, and then for 3 months if that's the correct duration. You can also use the OR functionality within the linked orders, and this can be used for when 2 routes are available to use. For example, paracetamol, where we give the option the patient can either be given orally or IV, and it will only let them administer one or the other of that for that order. And then we can also use the AND linked order for medicines which you want to be associated with each other, but are both to be scheduled. So an example of this could be where you want to document MST 10 milligram in the morning and 5 milligram at night. So by linking them using the AND order, they will appear next to each other in the MAR. And the reason we can't put them together in the merge one order is because they're different doses. So for a reducing course, we are going to, for example, steroids, we're going to link that order to prescribe the full course within the MAR. And we'll use the followed by linked order for this. So what you would do is you would create the order and the dose, and then here you put the duration that you want that dose to be completed for. At the bottom here, you click linked order, and then you will be presented then with another window to say whether or not you want to prescribe a similar order or a new drug order. So by clicking the similar order, then it'll present with basically the same makeout here. So, and then you can just change the dose from 20, say, to 15 milligrams for the 7 days, and you can link that order to the next dose and so on, just as per the regimen. So once you do that, you'll see in the left hand, the order will be generated on the right hand side, then say 20 milligrams daily for 7 days, then 15 for 7 days, 10 for 7 days, and then percent onto the MAR, and they'll be all linked together, and they will only be active on the days that the order is prescribed for. So for the first 7 days, the prednisolone 20 will be available to be administered, and then the next 7 days 15, and so on. At point of discharge, you can push tapering doses across to the discharge. That is one we can do. However, sometimes it doesn't read well for the patient, and it's better to alter by using the free text box. The other issue is with a follow by or tapering dose order, then it must have a stop date. So this will only work if it's a reducing course to stop. So if it was a reducing course to a maintenance dose, then it would not be you would not be able to use this tapering function. You would use the free text option. When you're doing this, you're going to enter the details within the text box if you're using the free text box, and then you're going to put the quantity that you want to dispense within the quantity to be dispensed. So if a tapering dose is ordered, it always needs to have adopted, as I said before. And one time where it will not work is, for example, if you are doing the apixaban 10 milligrams for 7 days and then the 5 milligrams twice a day. Unless you have an agreed end date, then this will not let you go further. Here you'll see that there's a hard stop, and it's asking you for how many days. So it will work if you know that it's definitely going to stop in 3 months. However, if there's no definitive stop date, then you need to use the free text button. and just manually type out the directions so the GP does not stop the medicine by accident. So